following program does not necessarily reflect the views, opinions, or policies of the City of Oceanside, its elected officials, KOCT, its board of directors, or staff.
Community Health Matters was made possible by a grant from the Tri-City Healthcare District and with additional support from Tri-City Medical Center.
Welcome to another exciting edition of Community Health Matters. Today's show is dedicated to sharing information with San Diego residents about heart and cardiovascular diseases and how to identify if you have or are at risk for this disease. Community Health Matters is produced by Tri-City Medical Center in conjunction with KOCT. I'm your host, Ricardo Berron, and I'd like to remind our viewers that this show is available in English and Spanish and also available online at koct.org. It's viewable on your iPhone, tablet, or desktop and easy to share with friends and family. Now, let's get started. Cardiovascular disease is the #1 cause of death in the United States and throughout the world. In this two-part series of Community Health Matters, we will discuss this disease with experts from our local community clinics and Tri-City Medical Center. In today's show, we'll learn about how cardiovascular diseases are diagnosed and what can people do to prevent developing heart-related complications. Let's welcome Jorge Gaspar, Clinical Integration Manager for Vista Community Clinic, and Dr. Samuel Poniachek, North County Health Services. Thank you for being here with us. So, Doctor, what are the most prevalent problems that affect the heart and the blood vessels?
The most prevalent problems are atherosclerotic disease. That's plaques in the arteries, hardening of the arteries, and those come from a variety of diseases like diabetes, high blood pressure, high cholesterol, smoking, and a genetic component as well.
Is there a difference between a heart disease and a cardiovascular disease?
There is. Heart diseases usually fall under the umbrella of cardiovascular diseases, so that's usually the distinction we make. Heart diseases are heart-specific, affecting the coronaries and the small blood vessels of the heart, and cardiovascular disease affects pretty much your whole body.
Doctor, you mentioned before atherosclerosis, which is the most common cause of cardiovascular disease. Is there a way to control it?
Yeah. The best way to control it are control the risk factors. High blood pressure, control your high blood pressure. Diabetes, control your blood sugars. High cholesterol, control your cholesterol. All of these can be done with exercise, with dieting, with eating right, and then other things like stopping smoking. Smoking is a big risk factor, or not drinking in excess alcohol. So those are the things you can do.
Now let's talk about strokes. What are they and what causes them?
Sure. So strokes are usually referred to, so the popular term is strokes, but it can refer to either brain strokes, which are when we have problems with blood flow not getting to the necessary areas of the brain, and that causes a stroke. You can also be talking about heart stroke when you have blood not reaching the areas of the heart that need irrigation, and thus you cause a condition called ischemia. Ischemia is when there is no oxygen getting to a muscle or a organ of your body, and that causes heart, in this case, organ failure or muscle failure. So it can be either of those conditions that get affected by stroke.
Are there any main symptoms, doctor, for someone getting a brain stroke or a heart stroke?
There's a lot of symptoms. Some of the symptoms for stroke, a brain stroke, for example, are you can have some numbness or weakness in the face, in the arm and the leg. Usually it's one-sided. You can have difficulty speaking. You can have difficulty with vision, dizziness. Those are the type of symptoms most people have.
And what are the implications afterwards?
Well, the problem with having a stroke is that it can either be transient, we call them transient ischemic attacks, when it's just a small little loss of these functions like the doctor mentioned for brief periods of time, or they can be permanent damages where if the blood does not reach that organ for extended periods of time, then either the organ dies or a part of the organ dies, so you're left with problems like the person is not able to, hemiparesias, which are, half of the body is not working anymore. You can have people lose speech pretty much forever. You can have really serious complications if those kinds of things happen.
One of the things, especially what he mentioned with these TIAs, or transient ischemic attacks, they're sometimes called mini strokes. Sometimes people can have some mild symptoms, like some mild weakness lasting less than a minute or 30 seconds or so. And so sometimes we can prevent a major stroke when people have these type of symptoms, and they should go in and see their health provider.
Now, doctor, please tell us what causes heart attacks.
The actual thing that causes heart attacks are plaques in the arteries. So the blood flow is blocked from getting to the actual heart muscle. And so that's what most commonly causes heart attacks.
And who is at risk of these cardiovascular problems or a possible heart attack?
Well, the people who we want to direct this program to, and everybody pretty much is at risk, but the higher risk is people who, for example, have diabetes or comorbidities, who are diabetic and have hypertension, diabetics and have high cholesterol, who lead a sedentary lifestyle, they don't exercise, they don't do anything, who have really bad diets. Those kind of people are really at high risk for developing a myocardial infarction.
People who smoke tend to have a higher risk for cardiovascular disease, and that's one of the easily modifiable risks.
Yeah, just break the habit, right?
Yes.
Now, doctor, does age, gender, and race relate to this disease?
Yes, it definitely relates. The older we get, the higher risk we have of having heart attacks, of cardiovascular disease, of strokes. Gender, men have a higher prevalence at this time than women, though women are catching up because they're smoking more, they're having more diseases such as diabetes, hypertension, so they're definitely catching up to men. And then race definitely also plays a part. There's African Americans have a higher risk of having high blood pressure, Latinos have a higher risk of having diabetes and high blood pressure as well.
Wow, that's very interesting to know. Does genetic play anything on the disease?
The genetic plays a huge part of predisposing to diabetes or hypertension or even high cholesterol. Most of these conditions, they're followed through generations. So if your dad or your mom had diabetes, hypertension, high cholesterol, then you are at an increased risk for these conditions. Coupled with that, to not taking care of yourself and not exercising and not eating right, then your risk increases exponentially. Take into account that not only your parents, if your grandparents had it, then you are also at a risk. So you have to be really careful when analyzing your family history and making sure that if there are conditions that existed within other members of your family, you let your provider know. So we can be on the lookout for those kinds of things.
Wow, very interesting that genetics play a huge role in this heart diseases. Very, very good to know. Well, thank you both for your time. Don't go anywhere. We have to take a short break, but we'll be right back with more Community Health Matters.
Your lifestyle is not only your best defense against heart disease and stroke, it's also your responsibility. Quitting smoking, eating healthy, and exercising are some of the measures that will help your heart and circulatory system stay strong and healthy.
Welcome back to Community Health Matters. I'm your host, Ricardo Berron. According to the Centers for Disease Control and Prevention, CDC, in 2011, 26.5 million adults were diagnosed with heart disease in the U.S. For many of them, a heart attack was the first symptom of their cardiovascular disease. Jorge Gaspar, Clinical Integrations Manager at Vista Community Clinic, and Dr. Samuel Ponechek of North County Health Services will tell us about the warning signs and how to be diagnosed. Thank you again for being here. So, doctor, what are the most common symptoms associated with cardiovascular diseases?
The most common symptoms are usually chest pain, pain in the arm, sometimes pain radiating to the neck. Other symptoms are shortness of breath, difficulty breathing, any difficulty breathing or chest pain with any exertion, sometimes atherosclerotic disease if it affects the lower extremities. It can cause you to have pain in your legs or difficulty walking, or strokes, or such as mini strokes, as we spoke about before, can have headaches, can have weakness or numbness in the face, arm, or legs, or difficulty speaking, or vision changes.
Wow, there are plenty of those. Are the symptoms alike to both men and women?
So usually women tend to have vaguer symptoms than men. Men have a higher prevalence of, for example, experiencing that chest pain we talked about and the radiation to the left arm. Women tend to experience more nausea, more sweating, more kind of feeling of impending doom, they call it. And men tend to experience more of the physical symptoms that we usually have with when you have a cardiovascular condition.
Now, doctor, can you please describe how are cardiovascular diseases diagnosed?
Yeah, heart disease is usually diagnosed by what's called a stress test, and there's different types of stress tests.
Okay.
You can do an ultrasound of the heart, which is called an echocardiogram. You can do a treadmill test, which you run on a treadmill, and they have electrodes on your heart that monitor your heart. But you can do also simple tests, such as going to your doctor, getting your blood pressure checked, getting your blood taken for sugar, for diabetes, for cholesterol. The more in-depth tests are things called angiogram, which they can measure the atherosclerosis in the arteries in the heart or on the limbs or in the brain as well.
And why does high blood pressure matter in cardiovascular health?
Well, high blood pressure in general, but affecting cardiovascular conditions. So your heart's a muscle at the end of the day. Your heart is a muscle, and it has to pump millions of times during your lifetime, and it has to pump all this blood out of your heart. And high blood pressure creates a resistance to your heart, so your heart has to work harder to pump blood to where it's supposed to go, which is your organs and your peripheral tissues. So if you have a high blood pressure, your heart has to work harder, and that's never good because your heart can get tired. If your heart gets tired, then obviously it becomes more susceptible to certain conditions. If I can give you an example, if before 50% of your coronary artery was occluded and you were fine, then maybe if your heart's really tired, maybe 50% is going to already cause you to have symptoms or cause you to have probably a stroke. So that's how high blood pressure really affects it. And we try to make sure that people understand that just because you have a blood pressure doesn't mean you have to stop seeing the doctor. People always say, "Oh, when I have diabetes and high blood pressure," no, please. If you have hypertension, just go to the doctor.
Do it now, right?
Yes.
Doctor, what are some of the possible complications that cardiovascular disease patients may suffer, like edemas, arrhythmias, et cetera, et cetera?
Yeah, so the main cause from high blood pressure a lot of times is kidney disease. They can have kidney failure. They can have heart failure where the heart is not pumping well enough and the blood backs up. They can have strokes and different things like that.
And the consequences of that can be?
They can have what's called the congestive heart failure. The heart fails, or they can have arrhythmias, which all can lead to death, disability. The kidney failure can lead to dialysis. When somebody suffers a stroke, they can have numbness or weakness of their arms. They can have paralysis where they can't move, they can't use their arms or legs, they can't speak. Those are consequences.
So obviously these conditions can be prevented, right?
Yes.
Right.
Can you expand on that, please?
Sure. Prevention in cardiovascular conditions are usually they're not limited to any one thing, but we really stress the fact that people who have a prior history of these conditions, go get their checkups, get their yearly checkups, get everything tested out, just to make sure they don't have it. If you're carrying up a few extra pounds or more than a few extra pounds, and you could eat better, you could exercise better, you could do a little bit of a better job of taking care of yourself, that would really always help you with these kinds of conditions. Like the doctor has stressed before, if you smoke, then do not smoke anymore. It's not as simple as that, obviously, but really, really try to understand that if you smoke, you just increase your risk of a heart attack or a stroke by probably more than tenfold. So those kinds of things they're avoidable, and they're problems that we can deal with.
Yeah. The most important thing is if we can catch things early. If we can control the blood pressure before it's high, we can control diabetes before it gets out of control, or cholesterol. If we can prevent a stroke before it happens, then the disability is much less. If we can prevent kidney disease from people having to go on dialysis, things like that, it's much easier earlier.
Well, thank you both for this great essential cardiovascular information. We have to take a short break, but we'll be right back with more Community Health Matters. Don't go anywhere.
Cervical cancer is the second most prevalent type of cancer among American women. That's why getting the human papillomavirus vaccine is recommended for all pre-adolescent girls. The vaccine prevents 2 of the most common types of virus linked to cervical cancer.
The American dream. American ingenuity. American craftsmanship. American justice. American perseverance. And the very idea of America itself. Colonial Williamsburg is an important piece of America that everyone should experience.
Welcome back to Community Health Matters. I'm your host, Ricardo Berron. Prevention, quick treatment, and state-of-the-art technology are proven methods of fighting heart and cardiovascular disease. If you're already experiencing some kind of problem with your heart or circulatory system, there are steps you can take in order to control your risk factors and prevent complications. As a reminder, our experts are Dr. Samuel Poniachek of North County Health Services and Jorge Gaspar, Clinical Integrations Managers of Vista Community Clinic. Thank you. Both for being here today. Doctor, how can we prevent cardiovascular disease?
The most important thing to prevent it is to control the risk factors, including smoking, stopping smoking, including treating high blood pressure or controlling high blood pressure, controlling diabetes, treating diabetes, controlling high cholesterol, and not in excess of alcohol. That raises blood pressure. You can control that. So if you can control all of these things, you can control your risk factors. The most important thing is to do it early, before somebody has a heart attack, before somebody has a stroke and are disabled, before somebody has end organ damage, like your heart or kidney failure, things like that.
And you know, I would also add on to that that the way to prevent it is to actually prevent it when you have young kids, when you have those 2 or 3-year-old kids or those 2 or 3-year-old grandkids, and we really have to try to stress the importance of a good nutrition at that age and the importance of exercise at that age. Because nowadays, I kind of get the feeling that a lot of kids are eating really unhealthy, a ton of sugary drinks.
It is a reality.
It's a reality, unfortunately. Yeah. You know, fast food is really prevalent, and we were just talking about this a little while ago, right? It's a lot less expensive to go and purchase, you know, fast food than it is to go into the store and purchase vegetables and meat or chicken or those kinds of things. But I think that if we educate the parents enough, those who are listening to us right now, and the grandparents who are listening to us right now, you know, please make sure that your grandchildren or your children are properly given the proper nutrition. Don't try to take the shortcuts and give them cookies. Don't take the shortcuts and give them chips. You know, those kinds of things don't help them out. And unfortunately, what happens is we're seeing really young adults nowadays with a really high incidence of diabetes, hypertension, and obesity. I mean, all it takes is for you to peek outside your window and count how many obese people you see walking down the street. And not just that, count how many of those look under the age of 20. And you'll see some incredible, incredible things that we didn't see before, mostly due to these factors that we just talked about. And the fact that with computers, laptops, you know, tablets, all this stuff, it just causes sedentary lifestyle. People don't want to get out of their house, much less out of their chair. So it starts at a young age. I've seen countless 2-year-olds walking around with, you know, the phone, and they're just staring at the phone and playing with the phone instead of playing outside. And I think that if we start there and we start a culture of being able to grow up healthy, that's what's really needed nowadays.
So can we agree, doctor, then that the younger generations are the highest risk of a coronary heart disease?
Well, that's where it begins. They're not the highest risk because the older you get, the higher risk you have. But it definitely begins there because it takes many years to develop these complications. So it is important to tell people that are young to take care of themselves to prevent it. Exercise, watch their weight, eat right, and then control some of the risk factors they can. Don't start smoking or stop smoking when they have. Don't drink alcohol in excess. And then when they do end up having a disease, treat it. Take the medications. Go see their doctor. Get the recommended blood tests.
Now, please expand more on the ongoing care that someone that has already or been diagnosed with a heart and coronary disease should take.
Right. So if it's too late and you already have diabetes, you already have hypertension, you've had a prior heart attack, which we have some patients that do. The biggest thing when these kinds of situations arise is to continue going to see your primary care provider. A lot of people kind of give up once they've been diagnosed, or they feel like they're invincible and nothing can ever happen to them. Or, I got a heart stroke once, that means I'll never have one again. I really never follow that line of reasoning, but a lot of people think that way. It's really important that if you've been diagnosed diabetes, hypertension, or high cholesterol, then you take the necessary measures to keep it from getting worse. So go to your doctor and listen to what your doctor has to say. Don't write it off. Don't ignore what your doctor. They care about you. They want you to be better. Follow their instructions. If they're telling you to exercise, I don't know, half an hour a day, walk half an hour a day. It's not that hard to walk half an hour a day for 5 days a week. It's really not that difficult. You should really try to make the effort to do those kinds of things. I think that's the biggest problem. People don't want to put the effort into managing their diseases.
Yeah, I think the people who've already suffered some complication are the highest risk. We want to try to prevent another event from happening. And doing those things, controlling your diet, especially salt, that's a big risk factor.
Sodium?
Sodium. And a lot of junk food has a lot of sodium in it as well. Exercise, eating healthy, eating fresh foods. Those are the things that we can do. Following your doctor's advice. If you're given a medication, take it. And if you can't take it for whatever reason, tell the doctor you're not taking it because it's causing side effects or because some people can't even afford it. So tell the doctors there's some programs that people can get medications for free. So they need to let the doctor know so they know that what they need to do next.
Right.
And by doing this, the risk can change over time?
Yeah, the risks.
Is there such a thing?
Yeah, the risks can change if people lose weight, if they eat right, if they control their blood pressure, if they control diabetes and their cholesterol, if they stop smoking. Those things can change. The risk that they can't change is genetics, their heritage. So those things can't change. So I tell them, work on the things that you can do. Those are the most important.
Right. I mean, at the end of the day, those risks are throughout your life. So if you work on them constantly, then you shouldn't have too much of an issue once you get into the later stages of life. So when you're younger, and this is something that we've talked about before, when you're younger, you have that energy.
Yeah.
You can go out and exercise. You have that will. You can, eat better, eat right. You have your full set of teeth, so you can eat, all those hard fruits and vegetables that some people sometimes don't want to. You have all these variables that you can do when you're younger, so you can be healthy when you're young. Once you get older, of course it becomes a lot more difficult. We're not going to tell a woman who is 90 years old and has arthritis in both her knees and has all these hip issues to go out and run a mile every day.
So it is a challenge when you get older.
When you get older, it's a challenge. There's still things you can do when you get much older and you have these kinds of conditions. There are exercises you can do in your own bed. There are small weights you can lift, very small weights you can lift, but you can do those kinds of exercises. You can eat healthier when you're older. Those kinds of things you can do. But I think it's important to educate our society that if you get into a healthy habit when you're young, the best thing about that is that it kind of carries over into your later years and you tend to not stray from the path of well-being once you get older.
One of the things I wanted to add to that is that many people who have these diseases that are risk factors like high blood pressure, diabetes, they don't feel bad at the beginning. They don't feel bad. So why do I have to take medication? Why do I have to exercise? The problem is then is the time to do it. Not later when they have complications, so they have heart attacks or heart failure or kidney failure. Patients at that time tell me, well, now I'm controlling my sugar, my blood pressure. But many times it's too late. They've already had the events. So they got to do it when they can.
Now let's talk about depression and stress, which pretty much there seem to be very common conditions nowadays. Can those increase the likelihood of suffering from succeeding heart attacks or strokes?
Yeah, depression, anxiety, and stress in general, they cause hormones to be released in our bodies naturally. Stress hormones that get released into our bodies. Those stress hormones can damage tissues, can cause complications in the long run. They can lead to heart attack and stroke. Yes, they can. They can also lead to rupture of brain aneurysms. They can lead to brain hemorrhages if that stress or anxiety is overwhelming to the body. Then yes, it can become a huge issue. I think that it also depression and certain chronic conditions, maybe not just diabetes, but other chronic conditions, they go hand in hand. A lot of times people feel hopeless, that they can't control the disease. They feel like they don't have the power to control their diabetes or their high blood pressure, and that actually spirals them down into depression, and it creates a vicious cycle of negativity within that person. So what happens when they get depressed, they start eating all these things they shouldn't be eating because it's over anyway. You know, that kind of mentality is really, really bad, and that's why we stress that these folks who are starting to feel like that, kind of with that feeling of hopelessness, to talk to your provider about it. Don't stay quiet. I think the silence is the biggest killer too, that they don't say anything before fear of being reprimanded or fear from being cataloged. And that's even worse because we want those patients to go see the psychiatrist or the social worker to get the help they need.
Doctor, any final words, message, advice to
Yeah,
watching this show?
I like to tend to tell people live healthy. That's the most important thing. Eat right, exercise, lose weight, and control the things they can't control. Is stop smoking if they are smoking. Don't start smoking if they haven't smoked. Don't drink excess in alcohol. And then control things they can't control, like blood pressure, diabetes, cholesterol. All of those things can help them in the future.
Any final advice, 30
I
seconds?
think just take care of your kids. They're the future, so they can't take care of themselves, so we have to do it for them. So that's really the biggest message I want to get out of this. Help them be healthy for a better tomorrow.
Well, that's all the time, unfortunately, we have for today. Thank you, Jorge Gaspar of Vista Community Clinic, and Dr. Samuel Pionechek for North County Health Services for joining us today. It was great information. I think it will be really helpful for all the families that are watching this show right now. And for you, I want to remind you that this show is called Community Health Matters, and you can watch this episode again at koct.org, and you can even share with friends and family, and please do. We have many great health services available right here in North County. I'm your host, Ricardo Berron, and this is Community Health Matters. God bless you all.
Tooth decay is the #1 dental problem among preschoolers. Fortunately, decay can be prevented by embracing good dental habits at an early age. Brushing your child's teeth twice a day using fluoride toothpaste and scheduling regular dental checkups are good starting points.
Community Health Matters was made possible by a grant from the Tri-City Healthcare District and with additional support from Tri-City Medical Center.